welcome to Champions of Care, brought to you by Oakwood Healthcare. My name is Mary Zatina, and today we're talking about a subject that's important to many of us, weight loss. Lots of folks have tried to lose weight and tried to lose weight. Maybe we lost some, and we tried again. Today we're going to explore a variety of options to help you get to an ideal healthy weight. With me in the studio today is a registered dietitian, an Oakwood dietitian, Lindsey Guerriero. Hi, Lindsey.
Hi, how are you?
Good. Welcome to Champions of Care.
Thank you.
Lindsey, I know an awful lot of very large people who say to me, well, I'm big, but I'm healthy. When does a person's weight begin to impact their health?
Overweight or obesity is classified depending on their BMI or their body mass index. So if your BMI, which is your weight divided by your height squared, if that's over 24.9, that indicates that you're overweight.
And how does the average person figure out their BMI?
Well, you take your weight in pounds divided by your height in inches. You have to times inches, you have to square them, so inches times inches. And once you get that number, you times that by 703. So it is a calculation, but that's a general calculation that many health hospitals use to classify obesity.
I see. Now, let's talk about some of the many diets that people are using to lose weight. What about the low-carb diet? Does that work?
It's very popular, the low-carb diet. It is shown to be effective as to lose weight in the first 6 months. But when you compare a low-carb diet to just a low-calorie diet at 1 year, there's no difference. So basically, if you cut out a large food group like carbohydrates, you're cutting out a lot of calories, which results in weight loss.
So another kind of diet is just counting calories.
Right. And I think that is very effective because once you count your calories, you get to see where a majority of your calories are coming from. And you get to realize, you know, maybe this has too many calories, maybe I should concentrate on something that has a little bit less calories when you're adding them up at the end of the day.
What about Slim Fast?
Slim Fast is considered a meal replacement. So instead of eating a regular meal, you drink a shake. And meal replacements are shown to be effective because it helps people that have a hard time choosing proper foods or choosing proper portions. It takes the guesswork out of that. But it's very important that people eventually learn how to eat real foods and to choose the right types of foods in the right portion size. But in the short term, you can use meal replacements like Slim Fast.
Now, you're a dietitian in a medical weight loss program. What does that term mean, medical weight loss program?
Well, a medical weight loss program means that it's run by a healthcare staff. So I'm a registered dietitian. We also have a nurse. So what that means is we're trained to incorporate clinical skills also into the weight loss program, which is different from Weight Watchers. Weight Watchers doesn't have a registered dietitian that teaches you kind of the fundamentals of healthy eating or able to incorporate medical nutrition therapy into their guidelines like a registered dietitian can.
And then how does the program work? Do I come to a class or something?
We have a 12-week program, and we have nutrition class every week. So you come and learn about the right kinds of foods, how to read a food label, portion size. You're also required to weigh in once a week. You have to turn in a food journal weekly, and I analyze it as a dietitian and give you specific feedback, and that's where I'm able to incorporate some of the other nutrition therapy if you have high blood pressure, high cholesterol, or heart disease.
So it's a 12-week program. I come once a week, and there's am I with others for a portion of it, and then there's some things we do one-on-one?
Yes, there's a group meeting, which helps because group support is shown to help people when they can connect and see that other people are struggling with weight just like they are. And then we also sit down in the clinic one-on-one where we can concentrate on more individual things regarding if they have high blood pressure, if they have high cholesterol, or certain medical conditions that need extra nutrition therapy.
And what does this Oakwood medical weight loss program cost for the 12-week session?
Our 12-week program is $299.
Oh, that's not too bad. And do some insurances pay sometimes for that?
At this time, no. But hopefully in the future, it's considered more of a preventative service.
What should people look for in a weight loss program when they're shopping around?
A weight loss program should incorporate nutrition education, the how-to, what are the right foods, why are they so important. It should also incorporate all the food groups. It shouldn't cut out any one food group like carbohydrates. It should focus on real food. It's okay to use a meal replacement as an option, but it's important that you learn how to eat real food, because eventually you're going to stop drinking or eating the meal replacements and going back to real foods.
So if someone is listening and they're really thinking about getting into a weight loss program, what steps should they take? What should they do first?
It's important that they get their primary care doctor's permission to participate in the program, because we are on a low-calorie diet and we are exercising. And this also helps us find out if they have any pre-existing medical conditions that we need to incorporate or would be beneficial to the patient to incorporate into their nutrition therapy.
Now we have a video element showcasing one of your patients in the weight loss program. Let's take a look.
Okay.
Before I came to Oakwood's weight loss program, I probably tried 3 or 4 different diets. I went to Weight Watchers, I watched what I ate, I counted calories, and I exercised, and I could not lose weight. Working with Lindsey and the rest of the staff in the weight loss program clinic has been wonderful. Anytime you have a question or if you're wondering about a certain food item, you just call them up or email and you always get an answer. Group sessions are weekly. There's a big camaraderie between us all because we all have the same problem and the same issues, and we swap notes and swap different foods that we found and the problems that we have. If we need to get motivated to exercise or to get back on track, we're all there for each other. My favorite part of the program is weighing in and finding out I did lose weight. I think this program worked for me because Lindsey explains the nutritional facts, and she also explains to you the portion control, mindful eating, and how many carbs and proteins you should have a day, including fats. I've lost 63 pounds in less than a year. I continue to lose more weight, and I continue to shake up my workout routines so I can lose more weight. I would tell the viewers at home that are watching who would like to lose weight, this is the best money I have ever spent on myself, and I'm worth it, and so are you.
Wow, 63 pounds in less than a year. That's from your good coaching. Was Jerry's result typical?
Jerry, I think, had such success because she really took full advantage of the program. She came to the classes, she weighed in once a week, she journaled her food, and she met with me and really took all my advice. And then paired with her own determination to accomplish the goals that she had set for herself in the beginning. She's a role model patient. I'm really proud of her. And she did great. She's still doing great.
So amazing things are possible with a little bit of coaching and a little bit of dedication.
Yep.
Lindsey Guerriero, you're a registered dietitian. You work with the Oakwood Bariatric Options Program. People can learn more about that at oakwood.org, and that's even where folks can find an application form to apply for the medical weight loss program. Is that correct?
They can download an application right off the website.
That's just great. Well, thank you so much for being here today.
Thank you.
When we come back, we're going to learn about bariatric surgery. There's many different varieties of that kind of surgery. We'll learn about how it's done and whether that option might be right for you. So stay with us, and thanks so much for watching Champions of Care.